Hello everyone, welcome to the channel Study Nursing by Sense Schools. Today in this video we are going to learn about Albuterol, which is a bronchodilator used in asthma, and this drug study belongs to the series of asthma. If you are someone watching the channel for the first time, please feel free to watch the related videos we have in the channel that includes short notes on asthma, nursing diagnosis, and how to prepare a nursing care plan. All right, so let's see what you learn in this video today. We are going to deal about some of the aspects of the drug that includes classification, action, what are the sound-alike drugs we have, the indication, the side effect, and what are the caution we should take when administering the drug. We also have some of the important elements, which is a nursing implementation, evaluation, and the treatment for overdose of the drug. So, without much ado, let's jump on to the drug section. I've included some of the forms of the drug. We are also discussing about various forms in the coming slides, but you might have seen albuterol mainly in the form of Ventolin. You might also have seen them in the form of nebulizations being given, and some of the main indications being asthma. So let's dive into the detail what this drug do. So the functional classification is bronchodilator. The chemical classification is adrenergic beta 2 agonist, or it belongs to the sympathomimetic drug. So speaking about the beta agonist action, it belongs to the adrenergic beta agonist drug. That means it works on the beta receptor cells. So when we talk about this, it also has, it is not sparing the other beta receptor cells. That includes beta 1 cells, which is found in the myocardium. And that's the reason you will find in the upcoming slide why we have the cardiac symptoms when we administer this drug. All right. Speaking about the sympathomimetic activity, it mimics the sympathetic nervous system. Feel free to look for the sympathetic nervous system activities, but if you are in short of time, let me tell you. So in sympathetic nervous system, you remember the fight or flight mechanism, and parasympathetic nervous system, you try to imagine somebody meditating. That means it calms down all the systems. All right. So this is what is the meaning. It is also known as SABAs, or the short-acting beta agonist drug. Levoalbuterol is also among the SABAs. You might have heard doctors discussing about SABAs in the section, or if not, this is a new learning for you. It's a drug of choice for asthma attack. All right. So moving to the sound-alike drugs. So please do not confuse it with atenolol, which is a beta blocker, or albutine, which is a human albumin injection. Um, Proventil versus Prinivil. Prinivil is an ACE inhibitor, and also Ventolin versus Vantin. Vantin is a third generation cephalosporin antibiotic. So please do not confuse albuterol with the other drugs. The action, in simple terms, I would say it acts on the receptor cells, the pulmonary smooth muscles, and that causes the relaxation of the smooth muscles that brings down the bronchospasm, and that results in bronchodilation. As a result, the air can smoothly enter. They can, breathe in a relieved way. So this is what it does. And also, it's important to note the second paragraph. It causes a stimulation on other systems, which is why you're going to see the drug side effects and also other effects on the system in the upcoming slide. All right. So it causes the stimulation of cardiovascular system. As you have seen, it belongs to the sympathomimetic drug category, isn't it? So it stimulates the sympathetic nervous system, and as a result, all of the actions increases. That includes the diuresis, the gastric secretion, the cardiac stimulation. So this is what drug does to the body. Speaking of the indication, it's mainly as we have seen, the action is bronchodilation. It is used in the condition where there is impaired airway, or the actions. All right, so that includes acute bronchospasm, reversible airway obstruction, prevention of exercise induced asthma. It's also used in bronchitis, emphysema, and bronchiectasis. Let's move on to the unlabeled uses. It's an interesting piece of knowledge for those who do not know, but it is used in hypokalemia in the dialysis patient. You might have seen them receiving albuterol nebulization when they are in the dialysis unit. If you haven't, please consider and treasure this knowledge because it brings down the potassium level. It causes hypokalemia. All right, so let's move on to the contraindication. This is where I would recommend you to watch this video multiple times because it's very easy to connect the drug with the action, indication, side effects, and caution when you understand the drug deeply. So feel free to watch the video multiple times. Speaking about the contraindication, as you have seen, it's a sympathomimetic drug. Any sensitivity to this drug causes problems or challenges, hence it's not desired. Any problem affecting the cardiac system that includes a heart block or arrhythmias or severe cardiac disease, this drug is not intended. As I've already explained, it do not spare the beta 1 cells which is present in the myocardium, so it also increases the activity. And suppose if you have a heart block, or suppose if you have arrhythmias or any severe heart condition, it could worsen. But that doesn't mean that this drug is not used in the cardiac disease. It is used in other disease, but for your knowledge, you can limit the discussion to this slide. All right, let's not overload with a lot of knowledge in this video. So albuterol is used in caution with several conditions that includes a cardiac disease or any renal disease, um, diabetes, or closed angle glaucoma, um, and also obviously all the other conditions which I've described in the slide. Um, and available forms of the drug is in the form of aerosol actuations, tablets, and in the tablets itself you have the modified release or the extended relief or the normal formulation, oral syrup, inhalation solution, powder for inhalation, and also inhalation capsule, and even in the form of spray. So there are several forms available for the drug. It's also interesting to consider learning the trade names of the drug which is present in your country so that you can learn well. I remember one of my experience as a student nurse. It was in 2007. I was posted in the surgical ward, and I came across a drug which had trade name as Happy, and I was very curious to know what the chemical name was, and I found out, if I'm still right, it was belonging to either PPI or H2 receptor antagonist. I would say ranitidine hydrochloride. So I don't know if that drug is still there in that country, or even in the market, but I'm just sharing the story with you. So yeah, speaking about the available form, it's also useful for you to learn about the trade name of the drug available in your country, which is used in your country of practice. That being said, let's jump on to this nursing implementation. Do not break or chew or crush the extended release tablet because that can affect the desirability or the therapeutic effect of the drug. It is especially crucial when you have patients with an NG tube or a PEG tube or any other, enteral route for the administration. All right, you can escalate this to your healthcare provider or the pharmacist and request them to do the needful to modify the drug. Also, give the drug when the meal is served, and of course, no alcohol and no sugar because that interferes with the absorption. And why do you think we serve the food with the meals? let's have a thorough learning on the drug, and then obviously you would be able to find it. In the geriatric patient, a spacing device is advised. It's somewhat like a peak flow device where you put the inhaler on the other end, and then you have the mouthpiece. You take the medication, it just gets absorbed as you inhale. So let me know in the comments if you wish to have a separate video on how to use the spacing device, or if you wish to have a video on spacing device, we can do that. Speaking about the aerosol route, the first instruction, I would say you can take it as general instruction for the other inhalation medication that includes salbutamol. It's nothing but to shake the MDI or the metered dots inhaler before use and ask the patient to exhale. Once they have exhaled, place the mouthpiece of inhaler and inhale slowly while you're depressing the inhaler. Hold the breath and remove the inhaler and exhale slowly, and allow 1 minute between two inhalations if they are prescribed with two puffs. Yeah. And the second instruction is to avoid any flames or source of heat. And the third is about the storage of the container, which is preferably in a light resistant one, and also exposed to the temperature. It's not recommended that you expose it to the temperature. Let's move on to the second section, or the next section. It's the adverse effects. So when you study the action of the drug, when you study the classification action of the drug in detail, it's really easy for you to write down if it's an exam, or even you have a drug waiver. It's very easy for you to tell about the side effects of the drug. Speaking about the CNS, as we have discussed, it's a sympathetic nervous system stimulator, mimetic drugs. It's a sympathetomimetic drug. Sympathomimetic drug. I'm sorry. So, since it belongs to this category, they might experience tremors, anxiety, or headache, or even dizziness or stimulation of the nervous system. All right, and they might also have dryness or irritation of the throat and nose. In the respiratory system, they can have the wheezing, dyspnea, or cough, and a miscellaneous flushing, sweating, anorexia, bad taste, or smell changes. Now you know why the drug is being served with the meal. It can also cause hypokalemia. Can you relate to the previous slide we discussed, where the drug is given in dialysis patients? And also it causes cramps, all right? And in cardiovascular system, it causes palpitation, tachycardia, hypotension in some cases, hypertension in some other cases. It might cause angina or dysarrhythmia, and that is why it is contraindicated when they have severe cardiac diseases. All right. So that's why it's all interrelated, and it's easy for you to learn when you understand the drug better. And in the gastrointestinal system, if you remember the action of the drug, it causes increased gastric secretions that might cause heartburn, and it could also cause nausea and vomiting. In my clinical experience, I would say I've observed patients having tachycardia and also having the tremors, especially when you see them reaching out to something. That's very apparent in those patients have taking albuterol. All right, let's move on to the nursing consideration. Let's begin with the assessment. It's important that you have a thorough assessment that includes a detailed vital signs monitoring, and also you have a look at the bronchial secretion, that is sputum, at the time of admission and also during the therapy. It's also very common for the doctors or the healthcare providers to order for blood gases that includes arterial or blood gases, and also as look for the lung sounds, because if you remember, one of the side effects of the drug is wheezing, right? And also it could cause paradoxic bronchospasm. So it's important that you check for all these assessments in the patient. And also I would say the vital lung capacity, it's measured with the peak flow. You could have observed the patients diagnosed with asthma have a peak flow meter recording, and they always do the peak flow. They assess the vital capacity, they write down the value or the volume. um, uh, so this is helpful for them to assess the effectiveness of the drug, the effectiveness of the therapy, and also to determine the prognosis of the disease. All right. So the second category, determine that the patient has not received a theophylline therapy, because if they are already on a theophylline therapy, the addition of albuterol treatment could cause additive effect. That is, already when you're on theophylline, you have certain adverse effect that includes the heart dizziness, palpitation, tremors, and all those side effects. And in addition, if you are combining it with albuterol, it could worsen the situation. So it's important that you rule out that. And also, clients' ability to self-medicate, especially when it comes to the elderly people, make sure that they have the capacity or they have the family with them, and also in other vulnerable group that includes children. All right. Uh, so these are some of the important points. And lastly, monitor for the evidence of allergic reactions. Paradoxic bronchospasm is a life-threatening side effect which is observed for the drugs in belonging to the SABAS category or any of bronchodilators category, where they can go for bronchospasm after taking the inhalation. So it's a side effect of the bronchodilators and it's a life-threatening complication. Please educate the patients to look out for this, for this phenomena, and also escalate to your healthcare provider if this is happening during the while they are hospitalized at your unit. All right. So let's move on to the patient family education. Um, Ask the patient not to use the over-counter medication, and also instruct them to have the spacing between one tablet or the one medication with the other, because it could stimulate the system. So to avoid the overstimulation, have the spacing. And in the second paragraph, we have included instruct the patient on the dose and to not overdose. And in my clinical experience so far, I've seen in many a times the patients using the drugs that includes albuterol and salbutamol, um, than in a larger variation, like they would go on a phase of dyspnea and they would use it. And that's not at all indicated. You need to educate the patients about the side effects of the drug. In my opinion, it is of especially important when you start the therapy, because the patient is curious to learn, and it's an opportunity for you to discuss this with the patients and the family, and that knowledge remains with them forever rather than doing an education in between. But I'm not saying you should not do the education, but I hope you got my point. If it is taken orally and the drug is missed, ask them to take the drug when it is remembered, and next time schedule a new time. But the point is not to double dose, and limit the caffeine products such as chocolate, coffee, tea, or cola. Let me know in the comment, why do we educate the patient with this point. All right. um, if you're having difficulty, they are all stimulants, so already these are sympathomimetics, and that already stimulates, so these are the stimulants, so it could have the additive effect. All right. So I spent a lot of time of yours with that point. In evaluation, yes, how do you evaluate whether the drug was effective or not? Obviously, with the symptoms, resolution of symptoms, and also improved metrics that includes blood gas and also other parameters. All right. And when you have an overdose of the drug, you treat it with the IV fluid and beta 1 adrenergic blocker, which is a beta blockers that includes metoprolol and bisoprolol. All right. So this is what is discussed. So with that, we have come to the end of the drug study. I hope you have learned about the drug. If not, I would recommend you to watch multiple times, or save the screenshot, post the video, write down in your separate drug study note that I would recommend you to keep. And also feel free to watch similar videos we have on the drug studies, anatomy, and especially with the nursing care plan and nursing diagnosis that we have in the channel. I wish you good luck and thank you so much for watching.